Good evening and welcome to the Rhythm Notes of Health with me, Kai Ianta. I am the soul of public health. I am so excited today. We have back in the studio with us Dr. Lori Johnson. And today, in bringing a close to our women's series, we're going to be talking about urinary incontinence. And a lot of women are wanting to know, they have some questions. And so we're going to get into this urinary incontinence with Dr. Lori. Let me bring her in. Dr. Lori, good afternoon. How are you? Welcome, welcome, welcome back to the Rhythm Notes of Health. We have missed you and we're glad that you're back. What have you been doing, Dr. Lori? Dropping babies?
Working. I took a little vacation as well. So just trying to enjoy my summer.
Yeah, no, absolutely. For those of you who can see us on YouTube as well as hear us, you see that Dr. Lori has a new look. She has these braids. She's getting her life together for her vacation, and they look really, really, really good. I mean,
Thank you.
I really like I like your braids. They look nice. So, ladies, take a breather from your norm and get you some braids and see how it works out.
Definitely.
Yeah. So, Dr. Lori, thank you for joining us today. We are going to close out this women's series. I have these gentlemen there; they are ready to get into the men's series. I have the doctors ready, and today we could not end the women's series without talking about urinary incontinence. And so that's what we're going to be talking about today. We're going to be talking about what it is, what does it look like if there is a look, what does it feel like, how do you get it? Why do you get it? And there's no need for you to have to remember those questions. I'll ask you again as we go. So, Dr. Lori, let's get into this urinary incontinence, which is I went on a field trip I went to two drugstores, whose name I will not call, because we talked about this before. We did like a mini snippet of urinary incontinence before, but
Right.
I visited this week. I visited the drugstores, two different drugstores and three different grocery stores to just go on the aisle with the women feminine products
Correct.
and to just pay attention to the hierarchy of the way that things were on the shelf, because we know that the things that are on the top of the shelf is what people buy often. And then as we go lower to the shelf is what people don't buy as often, right? And so what's really crazy is there were more products for urinary incontinence than it was for your cycle. So I don't
Yeah.
know if that tells about the people who were going shopping at the grocery stores, right? But there was like maybe three rows of items for urinary incontinence, and then it was like the sanitary napkins and those things, and then at the very bottom was like douching things, which I'm glad. That means that people are not douching as much, right? Because it's at the bottom.
Right.
So I say that to say that urinary incontinence is a challenge, I guess, that
Yeah.
women as we grow older are having. So let's just get into and talk about. Let's start with what is urinary incontinence? What is it?
Well, urinary incontinence means the inability to hold your urine. And it comes in a couple of different forms, but in general, it's being able to not control the flow of urine. So having leaking, having accidents, going when you don't want to have to go because you
Hmm.
cannot control it.
You can't control it. So because continence mean continuation, right? And
Mm-hmm.
so the incontinence meaning the break of the continuation, right? Of
Correct.
course, the urine is the urine. So, and you said that it is when you cannot hold, it's the loss of bladder control, right?
Correct.
Uh-huh. So, and can you just repeat it one more time? What urinary
Sure.
incontinence
It,
is?
it it's the inability to control the flow of urine. So you feeling a need to go and you're not able to stop it, it's going to come out. And there's a couple of different forms of incontinence.
Mm-hmm.
The main one we hear about is one called stress incontinence.
Mm-hmm.
And stress incontinence is that incontinence that happens when you increase the pressure. So you laugh, or you cough, or you sneeze, or
Okay. Okay. So we're gonna get into that. We're gonna get
get
into
into
that. We're gonna get into that. We're gonna get into that.
that.
Those are the types we're gonna get into that. I just want to make sure that everyone understands what it is, right?
Mhm.
And then who is often affected by urinary incontinence.
Well,
What
there's
age or population, I should say.
well, women over 40,
Mm-hmm.
about 50 million in women over 40 in the US deal with some form of incontinence. As you age, that number goes up, and men also have types of incontinence as well as they get in their 60s and 70s. And there are many, many reasons for that, but there are about 50 million women in the US right now who deal with some type of incontinence issue.
Mm-hmm. So no, I noticed that you said women when they get over 40. Right, but men when they get in their 60s and their 70s,
Mhm.
we always got to have the short end of the freaking stick. Except we give life.
Right. Well, and that's a big reason why,
uh,
because
uh, uh.
we've pushed out one or two or five or seven babies,
Uh-huh.
and they weigh anywhere from 5 to 10 pounds sometimes.
Uh-huh.
And in a woman, that muscle group is the same muscle group. So every
Uh-huh.
time you're pushing the baby and pushing and
Mm.
pushing, you're weakening that pelvic floor and making yourself more prone to incontinence. So the
Mm.
vast majority of women will have it because if you've ever had a vaginal delivery or more than one vaginal delivery, you likely somehow damaged your pelvic floor, and that can cause incontinence.
Okay, so okay, that's yeah, so that's very good to know. That well, because I think about the women like way back and a few generations before us that had like 6 and 12 kids, right?
Mhm.
They probably had urinary
Absolutely.
incontinence, but they probably didn't have a name for it, and
Mhm.
they sure didn't have a product to use for it,
Right.
and or a discrete product, right? Because now they have these discrete products that looks more like sanitary napkins
Mhm.
than the things that look like a diaper or adult diaper, if you will, right?
Correct.
So
Mhm.
they probably had to deal with it more, but didn't really know. They didn't have a name for it, right?
Mhm. Right.
Because of less research. But you said that the muscle is the muscle, and it's the same muscle that you use to push a baby out, right?
Correct.
And it's the same muscle that you use to say, "Oh, I got to use the bathroom, but I'm not going to go right now, so I'm gonna hold it," right?
Well, yes and no.
Okay, make that clear to
Um,
me because I'm always holding my bladder, and the doctor be like, "You got to stop doing that because you're gonna have urinary incontinence." So make it plain, please.
so so it's the muscle group. So in
Uh-huh.
the woman, um, the layers, the bladder, there's the bladder seat on the top, the
Mm-hmm.
vagina's in the middle, and the rectum's in the bottom.
Mm-hmm.
Okay, so
You
when
mean as far as the muscles,
as far as the layers,
the layers?
different
Okay.
layers.
Uh-huh.
So
Uh-huh.
it's like bladders in the front, vaginas
Mm-hmm.
in the middle, and then the rectum is at the back. So when
Mm-hmm.
you're pushing the baby out, you're compressing the bladder and compressing or flattening the rectum at the same time, and putting pressure on the muscles that control those two organs. So there's muscle. The whole muscle group is called the
Mm-hmm.
pelvic floor, and
Mm-hmm.
that overall gets weak. The specific muscle for incontinence is called the sphincter muscle. It's the circular muscle that encircles the area where the urine comes out, and it's
Mm-hmm.
supposed to tighten up enough to close that area called the urethra. But
Mm-hmm.
after you've pushed the baby out, you put pressure, you put pressure, you put pressure,
Mm-hmm.
that muscle gets weak. And so instead of it having a tight seal like this, your seal
Mm-hmm.
might be more like this.
Mm-hmm.
And
Mm-hmm.
so the seal you see there's a little hole in the seal. It's not super
Mm-hmm.
closed, it's a little
Mm-hmm.
open. And so that allows excess urine to escape when it's not supposed
Mm-hmm.
to.
So for those who are just listening to us, so what Dr. Lori did was show like if you were to describe using a balloon,
Mm-hmm.
could you use a balloon?
You could.
So
You can
can you
use one.
describe using a balloon for persons who cannot see the demonstration you just did?
So if you have a balloon,
Mm-hmm.
and let's say you put a knot at the end of the balloon,
Mm-hmm.
but then that knot gets loose.
Okay. Uh-huh.
The air will begin to escape slowly, not all the air, but slowly, because
Uh-huh.
the knot isn't super tight.
Okay.
So the muscle was like that tight knot, but as it weakens, the knot gets less tight, and urine is able to escape from the balloon.
Uh-huh. So that's the sphincter muscle, correct?
Correct. Mm-hmm.
Okay, so the sphincter muscle is connected to that pelvic floor,
Correct.
other muscles. So
Mm-hmm.
the other muscles become weakened, and the sphincter muscle, which is a part of the urethra, becomes weakened also, right?
Yeah. Mm-hmm.
Okay, so then because these muscles are weakened, then we have urinary incontinence, right?
Right.
Okay, so how does that differ with? I'm sorry. I'm thinking that's your phone, Dr. Lori. That's my phone. I'm sorry. So how does that differ with when you're holding your bladder?
When you're holding your bladder, you're working your sphincter muscle hard. So the bladder is like like I said, like imagine a balloon
Mm-hmm.
that's filled up with water,
Mm-hmm.
and that knot at the bottom is the sphincter muscle.
Okay.
So as the bladder fills up, or the balloon fills up, it puts more pressure on that sphincter to hold. Now, the bladder has to call a bladder capacity, and
Uh-huh.
there's a certain amount of fluid that once it gets in your bladder, you have the urge to go. It triggers the muscle to contract up. Now I gotta get ready and go, right?
Okay.
And
Uh-huh.
it's kind of like you hit that first threshold. So you're out like, oh, I could go, but it's
Yeah.
not urgent,
Yeah.
And
Uh-huh.
then you don't go, you wait a little longer, and it's
Uh-huh.
a little stronger. And you're
Uh-huh.
like, oh, I kind of need to go.
Uh-huh.
But you want to wait till you get home. You want to
Yeah.
you're in public. You don't want to use the
I feel
public
like you're
bathroom
talking
at
about me,
Walmart,
right?
and you want to just try to make it
I'm
home.
gonna get home. Yeah.
I'm gonna try to get home. So
Yeah.
you kind of hurrying, you
Yeah.
driving, and
Yeah.
your bladder's just filling up. And then
Yeah.
by the time you get to that house,
You barely make
you
it.
gotta go, right? Because your bladder has continued to fill and
Yeah.
fill and
Yeah.
fill and fill, and then it hits that critical point where it's
Uh-huh.
like,
I gotta
man,
go.
you gotta go, and then you gotta rush to get your stuff
Yeah,
out and go,
because the
because
closer you get to home,
otherwise,
your brain tells you, "Oh, you almost there," and it's really
yes,
the pressure's coming, right?
everything.
Yeah,
And so that muscle is like holding on, like, okay, you got 1 more minute because
yeah,
I'm about to be loose.
yeah, yeah.
And the sphincter muscles at the bottom, and that water is putting pressure and pressure onto that muscle, and then that muscle releases, and then that's when you go.
So then that can weaken. Can that weaken your sphincter muscle by holding your urine a lot?
Yes, absolutely,
Uh-huh.
absolutely.
Uh-huh.
Absolutely.
I have listen. I have always done that because I've always been very fickle about going to the bathroom in public, right?
Right.
So I have always done that, and my OBGYNs have always said to me, "You're gonna have to stop doing that. Go when you have to go."
Right.
And then so when you so you won't weaken, because when you get older, they always say when you get older, which I got older now, you're gonna have this incontinence problem, right? And
Mhm.
so at one point, and I'm gonna ask you to talk about this. So at one point, I was having this urge where, oh, I gotta go to the bathroom, right?
Mhm.
And then it was almost like sometimes I would barely make it, right? And then it was like, oh, I'm about to do it have a leakage, right?
Mhm.
And then when I went to the doctor, what she said I needed to do was reprogram my
Right.
bladder, right?
Right.
So what I had to do was I had to go to the bathroom maybe 3 times a day, whether I needed to go or not, right? And she said this was reprogram my bladder.
It was.
And so because she was like, you don't have a problem, but you need to reprogram it because you've been holding your urine for so long. Now you need to reprogram it. Because I was thinking, oh my gosh, it's finally got here. They said exactly what they said is going to happen. It's going to, right. But once I did that, right, it worked, and it reprogrammed and it stopped. So, and then now after that, I try to say, let me go to the bathroom because the
And
doctor said it's
that's
gonna happen.
actually a different type of incontinence.
Uh-huh.
That's called urge incontinence.
Oh, urge
It's
incontinence. Okay.
different than stress incontinence. So
Okay.
urge incontinence has more to do with your bladder spasming.
Ah.
And it's a spasm, and you're that spasm. Oh, gotta go right now. And
Uh-huh.
so you, as opposed to, so with urge incontinence, you don't get that warning.
Uh-huh.
Like with stress incontinence, you're like, okay, I gotta go a little bit. With
Uh-huh.
urge, it's like, boom, I'm going right now. And,
Okay,
and
understood.
it has to do with your bladder spasming. Kind of like if you've ever had a urinary tract infection and you have this
Uh-huh.
overwhelming urge to go all the time
Uh-huh.
because the bladder is irritated because of the infection.
Uh-huh.
So as the bladder is irritated, it just spasms. The bladder is a thin wall of muscle.
Thin wall of
It's like,
muscles.
it's like a
Uh-huh.
sac. It's a thin wall, so the muscle can contract, and that contraction will make you feel like, whoop, I gotta go. And
Yeah.
so that's called urgent incontinence, and that can be fixed with, like you said, bladder retraining, because
Uh-huh.
okay, I feel it, I'm gonna go, and you kind of
Yeah.
like calm your bladder down, if you will.
Yeah. Yeah.
And
And that's exactly what she said.
mm-hmm,
Mhm.
mm-hmm.
So I'm glad that you said that out, because I was actually going to ask you the question with urinary tract. And if you haven't listened to the urinary tract, we did urinary tract, and we really broke down the whole entire tract of the from the kidneys all the way down to the urethra, right? So if you haven't listened to that show, listen to that show, because it'll help you in understanding this show a little better. So you talked about the kinds, and so we talked about the stress incontinence, which we'll talk about more because it's the most popular one, right?
Correct.
And then we talked about urge incontinence. Incontinence. What other type of incontinence, Dr. Lori, are
Um,
there?
the other main one is probably overflow incontinence, and
Uh-huh.
that type of incontinence is more for patients who have like nerve issues. For instance, diabetics tend to have overflow incontinence.
Mm-hmm.
People who have had nerve injuries tend to have
Mm-hmm.
overflow incontinence. People who have had bladder surgery tend to have overflow incontinence, and that is a nerve problem. And
Uh-huh.
so that, or strokes, for instance, because their nerves have been damaged to the point
Mm-hmm.
where they can't feel when their bladder is full.
Mm-hmm.
So they just don't know
Go.
when it's coming.
Oh, so this is what the elderly have, huh? When they
Correct.
have to put them, when they have a stroke, and then they're bedridden, and they normally put them the Pampers or whatever
Right.
on.
It depends and things.
Depends. Thank you, because I didn't want to call it Pampers. Depends. Correct. They put the depends on, and so they have overflow incontinence.
Yes.
Ah, okay. So that's normally a elderly thing, or unless someone younger have a stroke and
Or diabetes
or
actually is a
diabetes.
major problem
Uh-huh.
with it, because
Uh-huh.
diabetes, as you probably know, affects all the nerves in the body, the
Uh-huh.
eye nerves, the foot nerves, et cetera, and also affects the bladder nerves. So
Uh-huh.
the nerves to the bladder can't sense anymore, and people
Mm-hmm.
say, "Oh, I was just wet." They don't
Mm-hmm.
know, they didn't feel it. They
Oh, they
had,
don't even feel that they're
yeah,
wet.
they don't feel the urge to go, and all of a sudden,
Ah. Listen, y'all make me so smart. I promise you. Every time I'm on here, it's like I'm always so excited to learn these new things. I hope everybody else is excited as I am, but I'm always so excited. And you telling me that, I'm thinking like, oh yeah, I remember something that happened to someone, and this is exactly what it was, right?
mhm,
So stress incontinence would be like the number one cause, right?
correct. They're
And
the
then
most
the
popular, most
the most
common.
popular, I should say, and then urge incontinence, right? In
Right.
which you have to go, and then the overflow incontinence, right? Which
Correct.
is affects the nerves where you can't feel,
Correct.
right?
Mhm,
Oh, okay. So then let's talk about the stress incontinence,
mhm.
which you mentioned a little earlier. But let's just go into detail and talk about how this stress incontinence comes about, and why is it the most common?
Well, again, childbirth makes it the most common.
Hmm.
Most women have had children. Also, women who've had heavy jobs where they had to do a lot of heavy lifting
Lifting.
for
Ah.
years, and they're lifting heavy things, because when you're lifting, you're using a lot of your abdominal muscles. And
Ah,
when you're doing your ab, you're putting pressure down on that floor. So repetitive lifting, heavy weights over and over for days and months and weeks and years will make your pelvic floor weak.
okay, I'm
Um,
sorry, Dr. Lourdes. I'm sorry. Start right there. Start right there. So, because I just repeat what my grandmother said, I just had an epiphany, which I always do on the show. But listen, so hold your thought, but I have a question.
mhm,
So, okay, so you just said that heavy lifting, right? So
mhm.
my grandmother used to say, right, would say, don't pick heavy things up. And what she would say is, you continue to pick these heavy things up, you're not going to be able to have a baby, right? That's what
Mhm.
she would say, right? And so it really didn't make sense to me. But now I tell my daughter the same thing. Don't pick that up. You ain't gonna be able to have a baby. Because that's what my grandmother told me, right? You're not gonna be able to have a baby. Like, don't pick that heavy thing up. That's way too heavy. Like let your dad pick that heavy thing up, right? But really and truly, see, she may not have known the exact cause of what she was saying or exact what would happen, but there was some truth to what she was saying because because what you're saying is lifting up something heavy is going to affect this pelvic floor, right? These muscles. And
Right.
if you affect the pelvic floor with the muscles that you say that you also push babies out with, then
Correct.
you may not be able to hold a baby to push it out. So don't let me find out. Oh shoot, don't let me find out. My dear, see, they didn't know why they
She
said
was
what they
in,
said.
she was in the ballpark. Like
Yeah, she was in the
she was in
ballpark.
there. She was in the ballpark.
Like she had a listen. Maria couldn't read or write, right? So, but she knew, but literally and truly, because really and truly, generation from slavery, they would pass things
Right.
down. That don't do this, don't do that, don't do this. And I guess when they were out in the field working, it was like you can pick the cotton, but don't pick this heavy stuff up because they probably saw that people had problems having babies from doing this. And so she didn't know the reasoning why, right?
Correct.
She just know you
If you
shouldn't
do this,
do.
then this might happen. So don't do it.
Don't let me find out. Okay, yeah. Wow. So listen, listen, it's a method to the madness. Even what grandmother would say, it's a method to the madness. Okay, so let's go back to stress incontinence. I just when you were saying it, I was like, don't let me find out. But I didn't know what she was talking about. And my grandmother really was muddy. I know Tyler Perry calls it to say it's Medea, but that's where he got it from. Like my grandmother really was Medea, right?
Uh-huh.
But I diverse. Let me get back on topic here. So stress incontinence. So
Yeah.
when your parents tell you that and your grandparents tell you that, they on to something. They in the ballpark of what needs to happen. They just don't know how to explain it, right?
They don't
But
know
we
how
got
to
Dr. Lori, OBGYN, who can.
whys, right? The whys and how it actually works. They
Yeah.
know that if you lift a lot of stuff over a long period of time, it's gonna mess some up down there.
It's gonna be something up down there. So ladies, don't be lifting heavy things up. That part, that's what we were getting. We was getting all around there to get back to stop lifting heavy things before childbirth, right? Because you want to keep those muscles strong. And then after childbirth, because you don't want to have urinary incontinence, right?
Right, that and prolapse. We'll talk about prolapse another time, but
Okay.
that's
Uh-huh.
also part of the condoms too. Prolapse, because when that whole floor gets weak, everything can and it
And that's called urinary prolapse.
uterine prolapse.
Uterine prolapse. Uh-huh. And just since we brought it up, let's just tell what it is since we brought it up.
So it's to make a really
Mm-hmm.
long story short,
Mm-hmm.
those all those muscles get weak,
Mm-hmm.
and your uterus can drop down,
Mm-hmm.
drop and
Mm-hmm.
drop out. Actually, fall out, if you will.
Oh.
But drop down
Uh-huh.
out of the area.
Oh, okay. Yeah. So why? Yeah, that's a whole nother show. Like, yeah, we definitely will have to talk about that because I've heard of urine prolapse, right?
uh,
But didn't understand like the details
what
of
was
it. So
dropping? What's falling out
what was
exactly?
falling out, right? And I really thought that was an exaggeration, like falling out, but you're literally saying it does.
I can show you a picture. I'll show you a picture.
Oh, okay,
I
why?
can't
Yeah.
see you. I'll show you a picture
Yeah. That it
on
actually
Facebook.
fell out.
Yeah,
That your
it
urine
fell.
fell out.
Yeah, yeah.
And if it falls out,
Well, go ahead.
how do you then urinate then?
Well, I'll show you a picture because
Oh,
it
okay.
doesn't fall like as in leave your body.
Oh, okay, because that's what I was
Hang,
thinking.
but it
That's
can
what.
hang below the opening of the vaginal area, so it can hang.
Ah.
People will frequently come to me and go, I feel like a ball down there. I feel a bulge. I don't know what it is. I think, they put their hand, they can feel something protruding, or they say when I go to bend over, I can feel this thing down there. I don't know what it is, and and typically it's that the floor has weakened enough so that the bladder is protruding, or the uterus itself is protruding out beyond the opening of the vaginal area.
Those muscles no longer have elasticity
Right.
to
They're
function or
stressed
hold
out.
up.
And so at that
Wow.
point you either have to take you can surgically repair it, tack it up, do different things. But and this happens. I had a lady maybe last
Is
year.
that common, Dr. Lori?
It is, it's quite common.
Okay.
It's quite
Wow. It's
quite
common. Wow. 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 Ladies, we got a lot that we got to deal with and know about and understand. And
yeah.
so I'm hoping that this series does it. So when we talk about stress incontinence, Dr. Lori, you talked about the coughing. Is that part of it?
Anything that increases your intra-abdominal pressure. So
Uh-huh.
cough, uh, sneeze, um, vomiting, anything that you have to you're putting a lot of pressure up and out.
Mm-hmm.
Um, so if the imagine the abdomen as a rectangle, right?
Mm-hmm.
Your neck is at the top of the rectangle, your pelvic floor is at the bottom of the rectangle,
Mm-hmm.
your abdomen is your front, the your back is the back side, and your sides. So when you
Mm-hmm.
put pressure, the pressure goes up and down at the same time. So if
Mm-hmm.
you're doing anything like that, so every time you cough, you're putting pressure in the abdomen and it's pushing down on that pelvic floor. When you
Mm-hmm.
sneeze, same thing. When you exercise, you jump up and down,
Mm-hmm.
same thing. And so with stress incontinence, because that sphincter muscle is weak, you can have leakage, either a little bit or a
Mm-hmm.
lot. Like, you see people like, oh, don't make me laugh, I'm gonna pee on myself. Oh, if I laugh hard,
Mm-hmm.
I'm gonna pee on
Mm-hmm.
myself.
Mm-hmm.
Don't make
Mm-hmm.
me laugh too hard,
Yeah.
because they
Yeah.
have a little stress incontinence with a weakness in that muscle. And
Yeah.
that is going to make
That's also that's a true thing, right?
for sure, for sure.
Ah, so with the stress incontinence, the menopause, right?
Mhm.
Because we have a large population of women who listen to us who are in menopause. How does menopause affect this?
Okay, so menopause, as we know, is
Mm-hmm.
not just the end of menses, but it's the decrease of your hormones. So
Mm-hmm.
one of the things that helps to keep that elasticity in that vaginal area is estradiol, or estrogen.
Mm-hmm.
So as we lose estrogen and progesterone with menopause, we also lose elasticity in that area. So we
Mm.
lose the elasticity of the vagina, and we lose the elasticity of the vaginal walls and the bladder and
Mm-hmm.
all that. Same is why we have vaginal dryness. The same thing why we have, things like that, because
Mm-hmm.
we don't have enough estradiol to the area, and we lose that elasticity. So that can make your incontinence worse. That can make your prolapse a little worse, because you don't have the estradiol going to the area anymore.
Mm-hmm. So the so we don't talk about often. I think estradiol, which we don't talk about, we say the synthetic version, which is the estrogen, we know that's made in the lab, right? So we talk about that often. And I think with women that it has gotten such a bad name, right? When we talk
Mhm.
about estrogen or estradiol, it's gotten such a bad name that we're not even clear on the importance that it is for women, right?
Right.
And all of the things that we need it for in our lives, right? And
Correct.
so when you just said that um, when we're lost of estradiol or estrogen in our bodies, then we lose elasticity in our bladder muscles, right, as well as our vaginal muscles, right?
Right.
And that's important to know. So that's why I just repeated it that you said that, because when I talk about the effects of menopause and menopause, what your mom didn't tell you, I don't talk about the bladder part, but it is very important to talk about, especially with the shelves looking like they're looking in the drugstores and
Right.
stores, right? Is that women are also dealing with this urinary incontinence. They mostly talk about, vaginal dryness and the hot flashes, right?
Right. Right.
But urinary incontinence is also one of those causes that can balance out again, right?
Right. Exactly. Exactly.
Oh, okay. So, okay, wow. And so, what about women with fibroids
As far as
as having urinary incontinence?
that's a little bit of a different mechanism.
Mm-hmm.
some if the fibroid is remember I said there's the bladder, the
Mm-hmm.
uterus, and then the
Mm-hmm.
rest. So if
Uh-huh.
there's a fibroid that's on the front or they call the anterior side of the uterus, the front side,
Mm-hmm.
that's putting excess pressure on the bladder.
Mm-hmm.
Those will usually have more frequent urinating. They may
Mm-hmm.
have a little more stress incontinence or more urgent incontinence because they have a solid ball that's pushing on their bladder.
Mm-hmm. Okay. Wow. So there are several different kinds, and you mentioned the main three kinds, right?
Hmm.
Which is the stress, the urge, and the overflow, right? And so, and then you also talked about the age, but what are some factors, Dr. Lori, with urinary incontinence? What are some factors
Uh,
other than
uh,
your aging? Are there factors other than your aging?
not so much.
Hmm.
Sometimes medications you might take different types of medicines can cause issues with incontinence. But
What about
a
caffeine?
caffeine will cause more frequent urination, but not necessarily
Hmm. Okay, more frequent, not necessarily incontinence. Okay,
because
and
caffeine is called a diuretic, so it pulls water out of your blood, out of your body. So you'll have more. You have to go more often, but not
uh-huh,
necessarily not be able to hold it.
uh-huh. And so, what about being overweight?
Being overweight.
Hmm.
Oh, it can
Hmm.
only in the context of um that same kind of increased abdominal pressure.
Uh-huh,
Because you got to remember that people who are very overweight, that the fat is underneath the skin.
uh-huh.
So once you kind of get it, yeah, out inside the body, the organs
Hmm.
are pretty much the same size as someone who's smaller.
Hmm.
Which is why when people lose a lot of weight, they have this saggy skin because it's the skin that's being stretched. And when someone's very obese, it's not the insides really. So
Hmm.
only in that excess pressure on the abdomen can cause maybe some incontinence, but not more than that.
Hmm. And so when I was doing the research, they talked a lot about temporary urinary incontinence, right? And
Mhm.
so we know that the urge would be that temporary urinary incontinence, right?
It can be,
The
yeah.
urge. Uh-huh. So what are some other things that causes the temporary
There's
besides holding your bladder, which is me? I'm
besides holding
guilty.
your bladder. That's a biggie. That's a biggie.
Mm-hmm.
Infections,
Mm-hmm.
like UTIs can cause you to
Mm-hmm.
have temporary incontinence.
Mm-hmm.
There's something called interstitial cystitis.
Mm-hmm.
It's kind of like um, you have the symptoms of a
Mm-hmm.
UTI, but no actual UTI, right?
Mm-hmm.
So
Mm-hmm.
it has to do with the bladder wall being irritable and so forth and so on. So
Mm-hmm.
that gives you an incontinence picture, but it's
Mm-hmm.
not purely incontinence.
Okay, understood. So what about alcohol? Because there's been a lot of talk about alcohol being a cause of having urinary incontinence. Is that the truth? Is that more like the caffeine, or is that not the
Yeah,
truth?
it's more like the caffeine. It's more like a
Mhm.
diuretic. So you'll
A
go a
diuretic.
lot more, but it
Uh-huh.
doesn't necessarily damage the bladder.
It doesn't damage the bladder. So
Mm.
urinary incontinence then is a damage of the bladder then, because you just
Uh,
used that word.
the would damage the nerves, but it doesn't do that. Not necessarily
Okay.
it damages. It's a damage of the sphincter muscle and stress, and
Uh-huh.
it is kind of it's a reversible damage in overflow. I mean,
Uh-huh.
in urge. I'm sorry, and
Uh-huh.
it is well. I guess that was nerve damage for incontinent for overflow. So damage of different areas, but
Uh-huh.
the bladder, it's not necessarily the bladder itself.
Uh-huh. Uh-huh. So then let's get into so we talked about what urinary incontinence is. We talked about the types of urinary incontinence. And we talked about who's more at risk, right, of urinary incontinence. We talked about some causes. Let's get into some preventive measures of how do we let's start with age let's talk about urinary incontinence. Let's start with the age, right? So since we're doing the women's series, we're talking about women. We're talking about teens to 25-year-olds and those people under 40?
Well,
Like, how can they help to prevent?
we're gonna do a Medea set and not lift heavy stuff. We're not gonna
That
lift a
part.
lot of heavy stuff over and over
That
again.
part. That
So
part.
we're gonna do that. We're not gonna call and ask for help. We're gonna call and ask the guy to help us lift it.
Number one. Number one.
Number one, this we're going
Yeah.
to we're going try not to have these big head babies that destroy our pelvis. Push these big
How,
old babies
how, do,
out.
how do you keep from having big head babies? Don't
Big
get with a
head
big
babies.
head
Right.
dad or something.
That's it. Make sure that the
If you
baby
got a big head and the
head,
father got a big head, then you probably gonna have a big.
a big head baby.
You're not gonna get me in trouble, Dr. Laura. You are not gonna get me in trouble. Okay, so no lifting, and then babies that are overweight because diabetic women tend to have larger babies, correct?
Correct, they do.
Hmm.
They do.
And that would be damage if they're having vaginal. If
Right.
you're having a
Well, like,
cesarean, it's different.
it's different if you have a cesarean, or like women who are pushing, for long periods of time. Um, like when you're if
Oh,
people
so long labors.
yeah, long labors,
Uh-huh.
pushing, and push, push, push.
Yeah.
They tend to have more damage because every time they're pushing, they're putting pressure on that muscle again and overall weakening it.
Uh-huh.
So things like that. Um, let's see, as far as preventive, don't hold your bladder. Like
Uh-huh.
don't
Go
hold.
to the bathroom.
Go to the bathroom.
Go. Yeah.
Make
Uh-huh.
yourself go. Don't try to wait till you get to the next whatever.
Yeah.
Go on and go.
Yeah.
Keep some tissues in the car.
You're not gonna keep talking to me, but okay.
Huh?
You're not gonna keep talking to me, but okay. Yeah. Go to the bathroom. That's me.
Go to the
Like,
bathroom.
I'm gonna wait. I'll be home in a minute. I'm only 5 minutes from home. I'll be there in a second.
Right. Just go on and go.
Yeah, go to the bathroom. Uh-huh. What about working out? What about working out?
Same with heavy lifting, like really heavy weights. We're doing like deadlifts and
Mm-hmm.
like that really big Valsalva, but that's a heavy weight too. That will cause, if you do a
But I
lot.
mean, what about preventive? Like, does it help with preventing? Does some workouts help with preventing?
If you can tighten your core, so
Mm-hmm.
at work and stuff like that will help prevent a tighter core, tighter abdominal muscles will help strengthen your core, strengthen your pelvic floor.
Mm-hmm.
But that real heavy like powerlifting
Mm-hmm.
will ultimately do the opposite and damage your.
Mm-hmm. And damage. I often talk about in undergrad and graduate school. I always took these world African history classes, and then two classes I took was about dancing, Africans and dancing, and we're Afro descendants. And one of the things that they talked about was the reason that the African women dance with their lower bodies, right, was to prepare themselves for childbirth, right? So you know how they dance more with their lower body, their abdomen and their hips, right? And it was to prepare for childbirth. And also because with everything that you're saying, doing those dances, tightening those muscles up, I guess when you do have childbirth and you do have that pushing, then your muscles are in a tighter shape that if there's some push, to limit the elasticity in, if you will, then it's small because you're doing these preventive dances and lower body movements to do. And so they talked about a lot that's why people mimic their dance, but they're not clear on why they dance in that way. It is intentional to prepare yourself for birth, and get those muscles together for birth, and which we don't talk about a lot because a lot of them, they're not going to the hospital. A lot of them, they have these babies and they're going on, right? So they have to know what they need to do to prepare. I guess holistically, that would be a holistic approach, is to do those dances. And we know we're not going to do those dances, but maybe I should I took like a couple of African classes when I was younger, and maybe it's helping me now, but maybe I need to take some more because it does like help in that way. Probably once it's gone, right, then you can't help it in that way, right?
And we really we always encourage my pregnant patients to stay active. We've
Mm-hmm.
unfortunately, a lot of us have adopted the more European concept of
Mm.
pregnancy, where you're pregnant, you're just kind of like a
Lay
wilted
down.
pillow, and you're kind of just laying in the bed and not moving. And it's called labor because it's work. It's called labor for a reason.
Mm.
So when you're moving and you're walking and you're squatting and you're doing things during the pregnancy, it's preparing your muscles and your body to do what it's supposed to do.
Yeah.
But then we've kind of got into this, oh, I'm pregnant, I can't get up kind
Yeah.
of
For
thing.
those who didn't see, she put her hand on her head like a dance more in distress, like, oh my
There's
God, since I'm
stress.
pregnant, I can't do
And then
anything.
we
Wait,
wonder
wait
why,
on me, right?
yeah, we wonder why we can't push these babies out and why we have such terrible
Mm.
labors and stuff.
Yeah.
But because walking every day, if you're healthy, you're not supposed to walk. Don't
Yeah.
just lay around and eat.
Yeah.
Walk,
Yeah.
get up, move. But that's
Yeah.
another topic.
Yeah, no, yeah, because we're
But
gonna deal with this whole pregnancy thing. But no, but I'm glad that we're talking about it so people can really understand. Um, the aspect of it is that when I mean, I had one child, I was one and done, but I walked, right, only because everything that I had learned, because I said I didn't want kids, and then I was like, okay, I'm gonna have one, right? But all the things that I learned, I walked, and then my doctor said walk, and because I didn't want to have a long labor, and I was ready for the baby to come, and it was like, you got another week or so, I was walking. We would go like on trips to just take pictures, so I could take pictures and walk, and just walk. And so fortunately for me, because I was walking, and it was like that week of, I was like going to different malls, just walking the malls.
yeah,
And I only had 3 hour labor, but my doctor said it was because I kept walking. She
right,
was like, you kept walking,
right.
right?
And
So that's important what you
you
said.
can't wait until you're like 37 weeks to go walk. It's
Yeah.
an ongoing thing for my first child. I was on labor for 5 hours.
Yeah.
They didn't think she was gonna come out that fast, and I was like, no, it's coming out.
Yeah.
And they looked and said, oh, it's coming out. I said, yeah.
Yeah.
And so, but I was in the city. I didn't have a car at the time actually, so I was
Yeah.
walking forth to work, to the store. This was part of my daily routine every day.
Yeah.
5 hours, my first child. So but I see it over and over again. My wilting, my ladies who just kind of want to lay around, don't want to
Yeah.
get up, and everything,
Yeah.
have the worst and the
Yeah.
longest labors. But
Yeah.
we digress.
Yeah, we digress because, but we'll have to start telling them. We'll definitely do that series on the pregnancy, but we'll still definitely have to start telling them. But you're going to affect some other things, like if you don't,
Correct.
it's not just even your long labor. You now are increasing your chances of having urinary incontinence, right?
Right.
Yeah. So we were talking about preventing. So we're talking about no lifting the heavy items, the long labors. Go to the bathroom, right?
Yeah.
And tightening your core. So what are some other preventive measures of urinary incontinence?
Well, you always want to do your Kegels, especially if you have a
Mm-hmm.
little bit. The Kegel exercise is to exercise that a woman does to tighten her core. I don't.
Mm-hmm.
Well, I'm not going to talk about Cardi B, but anyway, she talks about doing Kegels in one of her songs.
Yeah.
You don't know what song it is.
Yeah.
She talks about doing the Kegel, and what
Yeah.
and I
Yeah.
know Kegel is. Imagine if you're urinating,
Mm-hmm.
and the muscles you would have to use to cut off the stream.
Mm-hmm.
That's a Kegel. So when
Mm-hmm.
if you're urinating and you squeeze those
Mm-hmm.
muscles and the stream cuts off, you're
Mm-hmm.
doing that's a Kegel. And you can
Mm.
do that while you're watching TV. You can do it while you're driving
Mm-hmm.
your car. You don't have
Mm-hmm.
to do it while you're urinating, but that's the action and that's
Don't do it while urinating.
well, I mean, you could
let
do it to if you can't
yeah,
conceptualize it.
yeah, yeah.
Try it while you're sitting there peeing and
Oh,
stop.
understood.
I'm gonna try to
Understood.
stop the flow, the stream.
Uh-huh.
And that muscle group that you're contracting to stop the muscle stream is doing a Kegel exercise. And those are
Uh-huh.
something that we do and we tell people to do in between pregnancies, etc.
Uh-huh.
Before pregnancy to kind of get those muscles tight.
Uh-huh. So Kegel is spelled Kegel.
Correct.
Okay, so Kegel. If anyone wanted to look it up, to look up the Kegel exercise, and I'm sure there are like examples of people doing the Kegel exercise, so you can just be clear. No, no,
I mean, maybe
no,
somewhere.
yeah. So yeah, no, there.
Maybe.
Not see, Dr. Laura, you're visual, and so your mind went straight to the
It did.
visualization of that. And I was just talking about the exercise of it, and they say I'm doing Kegel exercise, like not necessarily seeing what's actually happening. That's your visual mind.
Okay.
that was funny. Okay, so but what are some things that you at your practice, right? And Dr. Lori will tell you how you can find her, or if you're not here, find a doctor who offer these things. But you in your practice offer some things that help with urinary incontinence, which could be preventive and or if you're in it, which will help. Correct?
Correct. Well, I'll start one place and I'll kind of work my way back. So
Okay.
there are treatments for incontinence.
Mm-hmm.
Some of our older ladies, we can use a device called a pessary. That's
What's it
P
called?
A pessary, Pessary, and that's for like an older person that's not sexually active, that is having a urinary incontinence. Y'all can go look it up. We've been
Mm-hmm.
using it for years. But the main one is it's a rubber, like a silicone ring, kind of shaped
Mm-hmm.
like a donut, and you
Mm-hmm. Mm-hmm.
kind of put it in the vagina, and it just kind of stays there, just stays there. And every so many months they come in, we take it out, we clean it, we wash it, we put it back in.
Wait. So
Put it
you put
in
in the
the
vagina,
vagina,
but
and it puts
why do
pressure
you put it in the vagina and the urine comes out of the urethra?
because remember, the vagina is in between the bladder and the rectum. So the
Okay.
pressure in the vagina puts the pressure on the device in the vagina puts
Uh-huh.
pressure on the urethra muscle.
Uh-huh. So
So
what? So
now
now it can feel something coming.
don't know so that it cannot release. It makes the sphincter tighter.
Well, okay. So how do they go to the bathroom when they need to go?
They can go when they need to go.
Uh-huh.
It doesn't keep it from opening at all. It just keeps the excess from opening. The excess.
Okay, understood. So, okay, so you said that you put that in the vagina,
Yes.
and because the vagina sits between the rectum and the bladder, right? It sits in the middle, right?
Yes.
So okay, because I gotta ask you because it's the women's series. So because you said it, you said I didn't. So now because I know I'm going backwards, but can harsh, wild sexual intercourse cause you to have urinary incontinence? Because it sounds like it from what you're describing, from putting this ring in here and saying that it holds it. So,
I mean,
yeah,
if you were doing it like I mean, I guess a lot of
yeah, what some people
cars.
do, like, yeah, yeah,
But I mean, it would have to be really kind of a very abrasive, I guess.
yeah.
Oh, and that's another issue with incontinence. Women can't hold during orgasm. So a
You
lot
said
of
women can't. You said women can't what now?
one of the other things that has the stress incontinence
Uh
is
huh.
when women are having orgasms,
Mm-hmm.
they can't hold their urine in. So I have some clients
Ah.
complaining of while they're in the sexual act,
Uh
they pee
huh.
everywhere.
Uh
And
huh.
that's a whole nother, another level of
Ah.
relationship with
Ah.
the
Yeah. 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 Yeah.
yeah. So that's another symptom of
What is
incontinence.
it? Is that a part of urge? Is that a part of the urge? No.
That's part of stress.
Stress. Okay. Uh
Because
huh.
when they orgasm, everything is like relaxed and it's released, and it just
Ah. Oh wow. Okay. Wow. Is that common?
it is. It is.
I'm always concerned when you say it is common, right? Because like I have not
People don't
heard.
talk about it. So much of this people just don't say out loud.
Yeah. So they tell you that this is happening.
Correct.
Yeah. Wow. Okay. Yeah. So we learn something new every day. Okay. I'm glad everybody's here learning with me. So okay. Yeah. So let's go back to treatments.
So,
Okay. So we talked about the
that's
pessary.
one for a
Pessary.
non-active person, a pessary.
Uh huh.
Then there are surgical treatments that have been developed over the years. There may
Mm-hmm.
be called a bladder sling or a bladder tack, or
Mm-hmm.
um, there was a procedure that came out with some mesh probably 15, 20 years ago.
Mm-hmm.
However, because there are multiple types of mesh,
Mm-hmm.
and one particular type of mesh has had some issues, and
Oh,
have
I heard that. Uh huh.
lawsuits. So
Mm-hmm.
now, whenever you say mesh, people automatically go to that.
PTSD. Yeah.
Yes, Dita. Oh no,
Yeah.
I don't want no mesh. I want
Yeah. 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 Yeah.
so I'm like, no, it's a different mesh. But then like,
Yeah.
oh, it's mesh, it's mesh.
Yeah.
So that the mesh was actually was actually it's called a TVT or transvaginal tape, which really puts if this is the urethra in the center, it puts like a sling and tightens the urethra to give you that extra support. It actually is and has been a great procedure. I've done hundreds of them and have had great results with lots of my clients. However, it's a much harder sell, if you will, now because of the mesh situation. I have patients who've had it and who loved it, but not as common as they used to be. And then so now we're looking for alternatives that are not surgical because people are afraid of the surgical alternatives, which involve most of the time some kind of mesh or some kind of material to help give that muscle the support it needs.
Now, did that TVT, the transvaginals, is it permanent, or do you have to like do it again? It's permanent.
It's permanent.
Okay. Okay.
It's permanent.
So those are the surgical treatments.
That's surgical treatments. And the only time I don't do a TVT is if someone's not done childbearing. Like if they're going to have another kid in 2 years, well, there's no point in me tightening your bladder now to push another big baby out. It's going to mess it up. So
Understood.
So there's been a push to find non-surgical treatments. And so I have a device in my office, and it is available nationwide, various places, called the Emsella vaginal chair. And it is literally a chair that you sit on. You don't have to take your clothes off. It's non-invasive. And it is like doing 20,000 of those Kegel exercises in 25 minutes. And so we do a 6 treatment series, and it has amazingly great results at tightening that sphincter muscle and reducing your stress incontinence. Reducing getting up in the middle of the night, reducing the accidents, and kind of getting you back to full functioning. It's the crazy part is it's FDA approved for that function. However, of course, because we live in America, insurance doesn't cover it.
Yeah.
But the Emsella is a great.
Because why would they think it's cosmetics? But okay. Yeah.
Right.
Yeah.
Right. And it's FDA approved for women and for men, actually, for men who have nocturnal frequent urination at night. For both things, but they don't want to pay for
and this is called the Emsella. Did you spell that?
It's EMSELLA, Emsella.
So EM as in Mary, SELLA.
Correct.
Emsella. Okay. And okay, so with the Emsella, then and I tried it. You had your the introduction when it came, and I went over and I tried it, and it's painless. You just sit there in the chair, right?
Yeah.
It's painless, and I really liked because to me it did a whole bunch of other stuff. That's a whole other conversation, but I liked it. I really liked it, right? And so, if you're in the, in the Atlanta area, Dr. Lori has this Emsella, and you said that you do a series of 6 treatments, and how far apart are they? Like you do one, and then you wait how long?
We try to get you in twice a week for 3 weeks. So 6, so like a Monday and a Thursday, Monday, Thursday, 3 weeks in a row, if possible. Some people have spaced them out. They do them weekly. It just depends on the individual.
And so, and how often should this be repeated? So once you do your 6 treatment series, how often should it be repeated to have another series?
Once you do your 6 treatments, you probably don't need to come in for like another 6 months and just do like a one touch-up session. You don't need to do that. It's kind of considered to be permanent. You do like a touch-up every 6 months for one session, and you're good to go from there.
Okay, so once you get the original 6 treatments, right, in which you would do like 2 times a week for 6 weeks, right?
Right.
Then you just need to come up like once every 6 months for a touch-up, right? To remind your bladder that this is what happened, is here, this is what, what. Okay. And it's FDA approved.
Right.
You sit on a chair, And again, I did it. You sit on a chair, you don't take your clothes off, you just sit there. You don't really feel anything. You don't feel it. I mean, I kept
That's
trying
a
to say,
little
do it.
tapping under your butt, like something's tapping
Yeah,
your vaginal area a little bit.
yeah, yeah.
That's all you really feel.
That's how
Doesn't
you
hurt
feel.
or anything.
Yeah, it doesn't hurt. There's no pain. And I did remember I was telling you how excited I was because I'm an analytical person. So I pay attention to every little changes in my body. So I am paying attention to everything. And I'm saying, oh, this is really which reminds me, I gotta get a part-time job just so I can come and get these treatments that I like. I literally like them, right? And if it's something that's going to help me function in a productive way where I'm not taking out of my livelihood of things that I do, right? Because I can't do things because I got urinary incontinence, then you need to do them, right?
Right.
Okay. Okay.
And
So
I'll
what
tell you, I tried the Emcella at a conference a couple years ago in Las Vegas, and
uh-huh.
I sat on it and I was like, this is interesting. I thought it was cool.
Yeah.
And the very first night I did it, that night I got up to go to the restroom,
Uh-huh.
and when I was laying down sleep and I got up
Uh-huh.
and I was like, wait, I could walk. I didn't have to like rush, because sometimes
Yeah.
you're laying down sleeping and you stand up
You
and
gotta
then
run.
kind of hits you.
Yeah.
I gotta hurry to get to
Yeah.
the restroom. And I was like, oh, I can walk. I'm good.
Yeah.
I was like, oh, this is amazing. And I'm
Yeah.
the kind of doctor that if it's at my office, I either use it, have used it, try it. I never
Yeah.
promote to a patient
I
without
like that.
trying it first.
I
Because
like
I
that.
can tell you my personal experience with it. So that device is super good. We had an older lady come, and
Mm-hmm.
she's a stroke victim,
Mm-hmm.
and she was coming, and funny enough, it's so funny perspective. She said I just don't feel like it's helping.
Yeah.
And but she walks with a stroke, and she's so,
Yeah.
but like the very first time
Yeah.
she came into the office. Before we could even bring her to the back, she had to go to the bathroom and pee. And
Yeah.
as soon as she got finished, she'd go back to the bathroom and pee.
Yeah.
And she moves, so her husband, he's helping her to the bathroom and he's helping her back, and he has to help her. And
Yeah.
he whispered us, he said, well, and so as she kept coming, she
Yeah.
didn't go as much.
Uh-huh.
We just bring her back. She was fine. But
Mm-hmm.
she was, I don't think so. And he said, well, I slept all night for the first time in 5 years.
He slept all night the first time in 5 years.
Yes, he said, I slept all night. So he
Wow.
whispered it to me like, I don't know what she talking about.
Yeah,
But
like
it hurt.
look. As a husband, I'm really not in this, but I am in this, right?
Yes, because he's her caretaker.
Yeah,
Like, he's
yeah,
her
yeah,
primary caretaker. And he has to help her physically to the bathroom.
yeah,
It's like she's not wetting, she's not
yeah,
getting accidents, I'm not getting up in the middle of the night to take her. So he was excited about
yeah,
the therapy because she was a stroke victim. So
yeah,
just that kind of stuff we're hearing, it just makes it great for us as the practitioners.
yeah. Wow. So are there other treatments for urinary incontinence?
Unfortunately, there aren't a lot. There
Mm,
are for urge incontinence, you can get like medication. So
mm-hmm.
wherever those commercials, you just go, you gotta go to like Detrol, and there are some other brands of medications that help reduce the spasm for the urge.
Are there prescription? They're
Yeah,
prescriptive. Okay.
they're
Mm-hmm.
prescription.
Mm-hmm. So
But as far as the stress incontinence themselves itself, which is the most common type, there just aren't a lot of wonderful options, and medications don't really help that because it's a muscle weakness as opposed to
mm-hmm.
nerve.
Mm-hmm. So it doesn't help as much.
Correct.
So you would say your number one treatment then for this urinary incontinence of all of the ones that we talked about that can be or helped, I guess, it
Mhm.
would be that Emcella, which is E as in elephant, M as in Mary, S as in Sam, ELLA, right? And
Right.
it's a chair that you sit on. And do you know what this chair is? What is the knocking? What is it releasing? What is it doing?
So there are magnets
Magnets. Uh-huh.
and underneath the seat of the chair, kind of
Mm-hmm.
like they use the same magnet that the Tesla Tesla car makers use.
Mm-hmm.
They're made by Tesla, and so
Mm-hmm.
the magnets are stimulating the muscle underneath your pelvic floor. So you position yourself over a certain spot in the chair, and
Mm-hmm.
as the magnets are working, they're tightening that muscle.
Mm-hmm. So how, because I'm just asking because I mean I don't know and I'm sure the people want to know too. So the muscles, how are they reaching the how are the magnets reaching the muscle? And what way is it reaching? Is it hmm is it what's the word I want to use?
It's like a
How it
it's like a polarity. So
polarity?
there's like,
Okay, uh-huh.
if you put yourself between two strong magnets,
Uh-huh.
the positive and the negative charge,
Uh-huh.
if you as a person are between those charges, it runs the charge through your body, whether you feel it or not.
Understood.
But in this instance, you're situating your pelvic floor between the positive and the negative charge, and as it's passing back and forth between the two, it's pulling your muscle along with it.
Okay, understood. Okay, I get it. I get it. So I said all that to say that it's safe,
It is safe.
right? Uh-huh. And it's FDA approved.
It is.
And how long has this Emsella been around? Do you know?
It's been in Europe before it came here, as everything is. It's been
Mm-hmm.
in Europe for like the past, I think, seven
Mm-hmm.
or 8 years.
Mm-hmm.
It's been here in the U.S. for about 5.
Or five. And so, Dr. Laura, the last thing I want to ask you about is the steam that women are getting.
Mhm.
And so one of the sale of the women that are doing this steam is that it helps with bladder control and muscles and tightening your muscles and may help with urinary incontinence. So I'm asking you as the doctor, because a lot of the people who do the steam, like some doctors do the steam, but
Yeah.
a lot of people who are doing the steam are non-medical professions.
Right.
They're estheticians, if you will, and those people. And a part of their sale is they're saying that this is what this steam is doing. And we did a show on the steam. It wasn't a doctor, so my questions were totally different than I asked the person, because I don't expect, because I work with doctors, I don't expect the person who's not a MD to answer questions that they're really not qualified to ask, because I'm not doing the audience a service, if you will. I'm asking you, your medical profession of, do you feel like it helps and it work? And I'm not trying to take money out of anybody's pocket, but I just want to educate people to make good
Um,
decisions.
I don't know a lot about the steam
And that's fair. Hmm.
doing anything with the muscles. I've heard women say that their partner enjoyed sex more after the steam. So what I'm thinking has to almost be like a dehydration process.
Hmm.
Um,
Hmm.
as you heat something up and it kind of pulls the excess liquid to the surface,
Hmm.
it makes the tissue a bit tighter.
Hmm.
Um, and by plumping the cells up like that,
Hmm.
the only thing I would doubt is that it's anything that's going to be long lasting, because
Hmm.
over time the vagina is going to make more fluids, the cells are going to regenerate, they're going to plump back up, and
Hmm.
so that's probably not a long lasting effect of having a steam. Maybe like if you get a steam today, you might feel a difference for a couple days that
Hmm.
follow, but nothing that's
Hmm.
going to give you a long term result because it's not
Hmm.
doing anything to the muscle itself.
Hmm. Okay, yeah. So, okay, so, but it will help some things, but you'll have to keep getting it done. Is what you're saying? But
Correct.
if you're having a urinary incontinence problem, you need to go see your medical doctor,
That
correct? And which brings me to, when should a person go to see the doctor?
when it's becoming a significant issue, when you find
Mm-hmm.
yourself having to put a pad on because you're leaking frequently,
Mm-hmm.
or limiting what you drink. I don't drink that much, I don't want to leak. Like
Mm.
like, well, you got to drink water. Oh, I can't drink too much water. Most women have a little leakage when they laugh or cough, and that's kind of to be expected. But if it's significant, where you're really just wetting your clothes and it's becoming
Mm-hmm.
a problem, you need to get that looked at. I've seen women where they leak so much that their bottoms are just raw from
Mm,
being wet,
mm,
like that.
mm.
So that's a different level, and you don't want to let it go like long term. We tend to
Mm-hmm.
let things wait and wait and wait.
Correct.
We
To
go.
put out the fire.
Yes, the
Mm-hmm.
fire, the whole
Mm-hmm.
fire.
Yeah, yeah. Wow. So, and Dr. Lori, and I mean, I know you got to go. I know I've kept you a long time. It took us forever to get Dr. Lori on here. Yeah, I know we done had a lot of people on here. We just couldn't get Dr. Lori back, so we got on here, and now I'm acting like I can't get off here. But I'm gonna get off here. I'm not gonna keep on because I got to bring her back. We start talking about this pregnancies. Have this pregnancy and Afro-descendant women, but Dr. Lori, so you mentioned it. You brought it up that some women that they have this urinary incontinence and then they're raw, right? In that case, you definitely should be going to the doctor. But if they are raw in that area, because I'm hoping that people are not letting the fires go, but according to you, they are. So what should they be using to protect their bottom area if this is happening? I know they should go to the doctor,
Yeah,
right?
they gotta get it fixed.
Got to get it
They
fixed.
got
Got
it
to get it
fixed.
fixed.
But you have
And a
to.
band-aid is not fixing, right?
That's right, like a drying
Mm-hmm.
agent, kind of like you would on baby with like diaper rash, some
Mm-hmm.
kind of a zinc oxide treatment to kind of protect
Mm-hmm.
skin from breaking down
Mm-hmm.
from the constant wetness with the urination. So like a
Mm-hmm.
thin or uh, what are those? I haven't had a baby around me in a long time, so I
Yeah.
forget the brands. But
Oh
those
yes, 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 yes,
big
yes, yes.
white ointments that you
Yes,
put
yes, 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 yes. Uh-huh.
things like
Uh-huh. Yes, 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 yes. What you put on a diaper rash is what you're saying
correct.
to protect the area from the wetness. But the number one thing to do is to go and get help.
Right.
And because there are some things you don't have to suffer in silence, right?
Yeah.
Or you don't have to suffer at all.
At
There's
all.
some things that medicine has to say, okay, well, this is just the end, right? But there are a lot of things because science is brilliant, right? There are a lot of things that medical medicine can treat and doctors can treat to help your living. You have optimal living, right? So with that, Dr. Lori, thank you for being here with us, the Rhythm Notes of Health, and tell us if people want to reach you or come get this Emcella from you, or even do you do referrals to people that don't live in the area to get the Emcella? You say fly in,
They
fly
can
in
call
first. If you can't
me,
fly in.
or we can refer them to someone that's in their area who does it.
Hmm.
But absolutely, I am the owner of Just for You Women's Healthcare in Locust Grove, Georgia. You can find us on the web, just for you, obgyn.com. You can find me on Instagram and Twitter at Dr. Lori J. And you can inbox me, which everybody inboxes me on Instagram. But Dr. Lori J, you can give us a call. You can Google us, Google me. But it's Just for You Women's Healthcare, and we're in
Hmm.
Georgia.
In Locust Grove, Georgia. And Dr. Lori is also on blackpink.org website. So, and all of her information, in case you did not get it, all of her information and how to make an appointment and how to reach her and her social media is on the Blackpink page under the Blackpink advisory team. And so if you did not remember that, then you can go on there and the information is there already. So Dr. Lori, thank you for spending time with us with this urinary incontinence, because I promise you, after we could not get our schedules together, I was like, okay, because the men want to do this men series and I'm excited about it. But I was like, okay, we're just gonna end it and we're gonna go on. But women were like, they see, so those are the women who are suffering in silence, right? They were asking me, I thought you said she was gonna do urinary incontinence, like you haven't done it. They was holding me to the fire because people hold you accountable, right? So they were like, I thought you were gonna do the urinary incontinence. It's like, so several people have asked me because they're clearly having these, they have these incontinence problems, right? And they need to, number one, get help. So if you're listening to this, if you listen to this, go to the doctor. If you're not close to Dr. Lauren, you can't go to her, go to a OBGYN or a GYN, right? Or you can even, if you don't even have the direct line path to go to them, you can go to your primary care doctor, right? And tell them.
Well,
But you can, Dr. Lauren, I'll go get you. I said, if they don't have a direct line
If they
to
can't,
them.
if you absolutely can't find a GYN, you can go to primary care. I prefer if it's below the waist, just go to the GYN. It's gonna save
It's
you
the
a couple of
OBGYN we're talking to.
yeah, if it's below the waist, go see the OBGYN. You're gonna save a couple of steps by going there and just getting it
Dr.
out.
Lori, some people have to go through their
They
primary care, their
do.
PCP, if they got an HMO to
Some
even get to you. Oh my gosh, you got my jaws are hurting. I'm
some
so
do. But
tickled.
if you can avoid it, just avoid. And I love my PCPs. I love my primary. I don't want their job. I don't want to treat all your issues. I really, really
Yeah,
don't.
yeah,
But
yeah.
if it's below the waist, just
Go to the specialist
yes.
because the OBGYN is the specialist and the PCP is, deals with everything. But if you don't have, if you can't get to the specialist of the OBGYN, then go to a doctor. Don't say, I'm not going to a doctor because I can't go to OBGYN or a GYN. I'm just gonna suffer in silence. Go to a doctor, right? But this isn't a reason to go to the emergency room, right, Dr. Lord? Because
No,
I'm a really big proponent of emergency rooms treat emergencies, right? So this isn't a reason to go to an emergency room,
no,
right?
absolutely not.
Okay, but you do need to see your doctor, preferably your OBGYN or your GYN, um, uh, because it's below the waist. Dr. Lori said it. Her information is on my page.
It's below the
Don't
waist.
get me beat up because I have all doctors on here. They'll be like, I was listening to your show, and they'll be like, I listened to your show, and Dr. Lori, I'm gonna say, Dr. Lori said that. You heard me at the end. I said,
Dr. Lori said
Dr.
if
Lori
it's below
said
the waist,
that.
go to the GYN. Just
Go
go.
to GYN, yeah. No, but thank you, Dr. Lori. This was really, really good, and I think with the first we did the urinary tract infections, and we really broke down the whole. All the bladder and the urine and everything, and so now just understand urinary incontinence and kind of just bridging it together in this women's series. I think that it has helped a lot of women. I'm hoping that it's helping a lot of women to understand, which will empower them to now go to the doctor and get help, and then just go and check out this seller. They're gonna say I'm always selling stuff to them. It's like, get your pellets. You got to get your pellets. You shouldn't be. You don't have to. When I see women flash, I don't even know them. I was like, ma'am, you don't have to be flashing. Like there's something that you can get, and you don't have to do this. So now it's gonna be, you don't have to be flashing. Now it's gonna be the seller. I just need to buy stocks and all these things.
You don't gotta buy leak. You gotta be leaking.
I don't have no stake in the game, but trying to help people, right? But the things really help. And like you said, you try these things, and like I've tried these things, and they work. And so there's no need in suffering in silence, right?
That's right.
Okay,
right.
so Dr. Lori,
I'm gonna say to anyone who's listening, I always hear this. One, I'm not too far, because if I was doing your hair, you would come and see me.
That part.
You, it's not too much money, because again, if I was doing your hair, if you wear weave and you buy bundles,
yeah,
my daughter buys bundles. I know how much they cost.
Yeah,
we will spend what we want to spend for certain things. If you come in and tell me that that's too much, you have a never full on your arm, I'm gonna say, but that never full though, that never full that you bought. And I understand we like nice things, but we have to make sure that our health is our number one priority.
Yeah, that's right. So I told you that my old GYN who's retired now, she would say pay for your food or pay for your health. But I'm saying pay for your health or pay for your death. It's one of the two, or have somebody else pay for it, right? Because then you won't be here because you chose to put your money somewhere else and not taking care of yourself as your whole self. And so that was a very good point. And we can't stress it enough to take care of yourself in the things that you do, so you can just live productive. Like, it's not okay to just live a long life. You need to live a long, productive, happy, vital life, if you will. Thank you, Dr. Lori. Thank you for your time. Thank you for finally we had to almost send the sheriff over to the house to say don't let her out until she does this. Until the office like, don't let her out until she do this podcast. But we got it done, Dr. Lori. So we do all of this for you, just so you can empower you. Although I know some of this stuff, I learned so much today, but I'm always learning things. So I'm a forever student, I'm forever learning. So I've learned a lot today, and I'm going to be continuously referring and giving people information. Is why I got to go out of town to refill my cup, because I've depleted it. So I got to go refill it up. But thank you, Dr. Lori, just for taking the time to educate us in the things that we need to educate. Dr. Lori, again, tell the people one more time how to reach you.
Just for You Women's Healthcare in Locust Grove, Georgia. Just for You OBGYN.com on the web, or Dr. Lori J on Instagram and Twitter. Please come and check us out. Say hello to me, wave at me. Tell me where you met me or where you heard me, and I can always put it back together
Yes, yes. Tell them you heard them on the Rhythm Notes of Health podcast. Absolutely. Thank you, Dr. Lori. You have a good day. Bye. So that was Dr. Lori, and it was a good show. And right now, it's time for us to talk about our musical soul note for the day. And I had to think about, I talk about the same people over and over, and I had to kind of get it together. Like, who are you going to talk about today? I like to talk about independent artists. So today I decided to talk about one of my favorite male artists, Raheem DeVaughn. Raheem DeVaughn has over 10 to 12 albums. He has been around for a very, very long time. His first, and I'm playing, because this is one of my favorites, Guess Who Loves You More, from his first album, which came out in 2005, The Love Experience, as you see here over my shoulder. But since then, sometimes he puts out an album every year, sometimes twice a year. And it's always a play. You can play the album from the beginning, the first song, all the way to the end, because he just knows what we're looking for. He knows good music. He can put it together for us so we can, just enjoy ourselves with us, for us rhythm and blues persons who listen to rhythm and blues. Raheem DeVaughn is Raheem DeVaughn on all his social media. There's RAHEEMDEVAUGHN. So he is Raheem DeVaughn on all of his social media. You can get him there on all those social media. You let him know that the Rhythm Notes of Health sent you, so you can let him know where you heard him from. That's Raheem DeVaughn. Check him out. And again, he has a whole lot of albums, but this is my favorite album, one of my favorites, Love Experience. And this song that we're playing is Guess Who Loves You More. So check him out, listen to him, let him know you heard him on the Rhythm Notes of Health, podcast. And let him know. So this has been a really good show. I am excited about going into this men's series, which we're going to be going into hopefully our next show. So Dr. Lori told us a lot of good things about urinary incontinence. Let's just talk about, she told us about three main kinds, and the most popular one was stress incontinence. And then we talked about urge incontinence, and then overflow incontinence. Those are the three main ones. But then what I want to kind of reiterate right now is the preventive that she talked about. We laughed because we talked about, my grandmother told me no lifting these large items, and she knew what she was talking about, didn't know how to explain it. But so no lifting heavy items. Let someone else lift it for you, right? Or get some assistance with lifting. Make sure that you're going to the bathroom. Don't be holding your bladder if you don't have to. Tighten your core with your Kegels. And again, you can look up the Kegels. And some of the treatments that she talked about was non-surgical, was the Emsella, and that's E as an elephant, M as in Mary, SELLA. And with that Imsella, she suggested you get 6 treatments, and that was 2 times a week for 6 weeks, and then come like every 6 months to get a touch up. I am so excited. We just had this really good Healthier You Health Fair. I am depleted from talking to everyone. I love meeting you out in the field, but I'm going to take a vacation in my 2 week until the next show after this one to just refill my cup. Remember, we repeat what we don't repair. Your race and where you live should not determine whether you live, right? Let me say that again. Your race and where you live should not determine whether you live, because my goal is to concentrate on underserved populations. And remember, when life moves fast and your mind does too, remember to breathe. It will get you through. My name is Kai Ayenta. I am the soul of public health. I have enjoyed today's topic. Until next time, have a good day. Bye bye.